Hello, friends. Welcome back. Finally, after a delay, I am very sorry about that. I really tried my best, but my wife also was trying a lot. No, wait. Let me introduce. First of all, let me introduce myself. I am Rajshekhar. I am Dr. Rajshekhar. I am a doctor by profession, been in the medical profession for a few years. I am a doctor of the brain, and I am also interested in the mind and other things, health. But I also love to do these things where I am connecting with people, when I extract information, knowledge, learning from people, important people. And today I am super excited because I have with me somebody very important. So let me say a few words. See, don't judge me because I know her for the last 20 years, and when she came into my life, it completely changed my life. I became a different person, and she's taught me so many things. I learned how to talk to people, how to enjoy myself, how to have fun, how to be happy, how to express myself, and it's changed my life. If I keep on talking, you will know, okay, this guy is in love with her, so that's why he's talking like that. But that's the reality. She's been a great wife, a great mother, a great daughter, and a fantastic human being. But today, I want to talk to you about her surgical aspect, the professional aspect. She's been in the field for close to 30 years now, and she's had a fantastic career so far. She's a fantastic surgeon, and I am talking about that not as somebody who's so close to her and who's biased towards her. I know what she is like. I remember her telling me that she had decided to be a surgeon long ago, much earlier than even I thought about, doing something in life, and she dedicated her life for it. I've seen her, the way she takes care of patients, the way she is dedicated to them. She doesn't leave the operation theater till the patient is completely, completely out of anesthesia and has been taken care of. So I can keep on talking, but what I learned about surgery from her is that what she says, everybody thinks that a surgeon needs to have a good hands, right? That's what people say. And what she says is that's required, but that's not enough. A surgeon needs to know when to operate, and even more important, when not to operate. Now that's a very important thing, and I leave you to digest that because I can't wait to introduce her. I am really excited, enjoying myself, and I want to introduce my beautiful wife here, who's sitting right next to me in her own room in the hospital. Please.
Hi folks, Dr. Manipriya here. Yes, even I've been waiting for a while to come and chat with you, discuss a few things, issues which are of relevance. I'm a general and laparoscopic surgeon practicing in Dubai for the past 7 years. I am a surgeon for more than 20 years in my profession. I'm from Bombay, and I have practiced in Hyderabad for more than 10 years, and then I have moved into Dubai. I'm loving this place and the people are very nice. Today I'd like to talk a little bit on breast ailments. Why I chose this topic? Because it's a very relevant topic given the media hype that is going around, and it's for a very good reason. This is one cancer which has a possibility of complete cure, right? Cancers, generally the perception is that you cannot cure it, right? But breast cancer is one ailment which you can cure it. It is, you can completely get it out of your system, but provided that is picked up at a very early stage. And for this, we need to be aware of what it is, how it appears when it appears, and what you should do when you find something and when you're confused about it.
So, let me give this talk a little structure, because I know we need to know a lot of things, and I don't know if one short talk would cover everything. Do you think so?
Yes, not exactly, but at least I can highlight on certain points. I would like to at least give some take-home messages at the end of my talk, so that there is some value to whatever I am talking. It should not go completely off your head.
Right. So what I'd like you to start off first is to tell us a little bit about breast ailments.
Okay.
What are the symptoms?
Okay, to summarize, actually, if you want me to talk on breast, I could talk on hours together. There's so much and there's so much information, but I'll try my best to give you a gist of of the whole thing. Now, the most common complaints that a woman would have with regards to a breast can be classified as pain and a lump. A lump means a swelling in the breast, right? These are the most common ailments that a woman would feel. And the moment she has any such feeling, the first thing that comes to her mind is, do I have cancer? So if I see, I am close to 20 years in my practice, and when I see a patient entering my room, and the moment she utters the word, I have a breast complaint, she's so terrified, she's so afraid, she's so frightened, because she only thinks is the doctor may say that now you have a cancer. But no, I'd like to highlight on certain points. Most commonly seen breast complaints are non-cancerous, and breast pains is one of them. Breast pains most commonly occurs in non-cancerous conditions, which are very commonly seen in women, especially during their menstrual age. That is, till they achieve their menopause, it's very common to find breast pains. And lump or a swelling, that is another common complaint. Well, lump could be due to various reasons. Breast cancer is just one of them.
Okay. So, since you've been talking a little bit more about breast cancer, can you tell us a little more about it?
Okay. Breast cancer is a cancer, like we know. All know what a cancer is about. Now, let me begin with highlighting on what are the risk factors to develop a breast cancer. This awareness is very important, so you know you can categorize yourself into where you lie based on these factors. The risk factor to develop a breast cancer is a very strong positive family history. Family history of either breast cancer or ovarian cancer. When I say family, the thing is more towards the maternal risk factors, because the transmission of the genetic factors is more common on the maternal side of the family.
So that means if the person's mother's side has a history of cancer, then she has
a higher risk to develop a breast cancer. Correct. Right. Unless there is a consanguineous marriage where all these factors become immaterial.
Right.
Also, a woman who has a close family member having ovarian cancer also puts her at a higher risk to develop a breast cancer. Okay, so this is the very a strong risk factor, I can say. The other risk factors are nulliparity, meaning a woman who does not bear children, does not conceive at all. Never conceived. A woman who does not breastfeed her child. A woman who has been on hormonal supplements, especially the oral contraceptive pills, for a long period of time, usually we say 2 to 5 years and above, a continuous regular use. These women have a higher risk to develop a breast cancer. Now, there are other risk factors also, which earlier down we would put it as other factors, like alcohol, smoking, sedentary lifestyle. 10 years back, these would be as other factors for any problem, actually. But the recent World Health Organization has released data. This was in 2012, which highlights that close to 21% of deaths due to breast cancer has occurred in women who have a sedentary lifestyle, who have smoking and drinking as a regular habit. So if you see, 21% is a very high percentage.
True.
And going by how the trends are in people, the adoption of Western lifestyle with all these things, smoking and alcohol being so common even among women, that the trend towards breast cancer and its after effects have risen.
Okay.
On the other hand, we have better diagnostic modalities which help us to identify a cancer at a very early stage, so that we can offer cure.
Right.
So this is how it works.
So from your talk, what I'm getting an understanding is that if a woman doesn't conceive, say till she is 30, 35 or even 40, or has not conceived at all, and then has these social habits. So that person and has a family history of having had cancer. So that puts her at a much higher risk of developing this cancer.
Absolutely, yes,
And,
that is right.
And what are the problems about this cancer? Like, what is the reason for it becoming such a big issue?
Okay. As I was mentioning in the beginning of my talk, identification of a cancer at a very early stage is of paramount importance to give the best outcomes.
Mm-hmm.
Now, today we have technology wherein we can pick up cancer even when a lump is not formed.
Mm-hmm.
Okay, let me tell you what are the initial features and what should a woman look for when she to consider even as a cancer. Now, breast cancers very commonly present as a painless hard lump in the breast.
Okay.
Painless hard lump. Now, pain is something that you can perceive, you feel, so you know when there is pain. But if there is a lump and you have accidentally noticed it, it's not troubling you. You are not troubled and it is just there. I mean, a woman would not give much importance to this finding. And if we have seen in the past 20 years earlier on, not a woman not going to a doctor because she has accidentally found a lump was the reason why they were picked up at a late stage.
Okay.
Pain in a cancer often develops only when it has spread.
Okay.
So we are not waiting for a pain to develop in the cancer.
Right.
On the other hand, we stress a lot educating women if they find anything like a lump or any feature to go to a doctor and get herself evaluated. So it is clear whether she is dealing with a lump which is cancerous or not. There are other lumps also which are painless and hard, which are not cancerous. The most common being fibroadenoma, if anybody has heard about this. Fibroadenomas are more common in the younger women, usually in the teens and early 20s. It is firm, it is painless, it is accidentally found, but this is not cancerous. So how will a woman know if she finds a lump? Is this cancer? Is this not cancer? She will not know. But it is important that she visits a doctor, gets herself evaluated, examined, undergo whatever tests are required, and be sure that the lump, whatever she has seen, is a benign lump or not.
Okay. You know, I've heard a little bit about this case called Angelina Jolie case. I mean, I know the actress, the celebrity, the star, but what is this Angelina Jolie case? Can you tell a little bit about it?
Of course. I mean, Angelina Jolie had created such a turbulence with what she has undergone. She underwent a prophylactic mastectomy. She removed her breast without a cancer being developed. Why did she do so? Now, she had a very strong positive history of both breast cancer as well as ovarian cancer. Now, when she knew, I mean, today information is available on the net, so everybody has access to it. So when she got it, today we have genetic evaluation called as BRCA genes, BRCA 1 and 2. The tests which are done to identify your risk factor to develop a cancer, mind you. BRCA genes being positive or negative does not mean you will develop a breast cancer. It means you have a higher percentage of developing a breast cancer, though the percentage is very high, close to 60 to 65%. But medical scene today has not evolved to a stage where a doctor can tell a patient, get your breast removed because you have a high risk for breast cancer. See, breast is an important organ for a woman, and removing a breast without any diagnosis is still not very acceptable. Now, why she underwent this, it was not a overnight decision. She had a lot of counseling, she met the doctors, she sat with the family, she came to a decision after a lot of thought and lot of thinking as to an understanding of what she is undergoing.
Right.
She has also undergone oophorectomy, that is, she got her ovaries also removed, and she's on hormonal supplements. Now, this is not something that we can advise every woman, because hormonal supplements have their own side effects, they have their own effects on the body, which should be very cautious, right? But she is a very high personality. She can get everything and she can get the best of everything. So
True.
but it's not easy even for her.
True. And as a star, as a celebrity, it disfigures her, right?
Exactly. So, I mean, if she has, of course, they must have undergone cosmetic procedures. You have many such things that are available which are expensive too. So, a woman should understand why she's undergoing. Now, if you ask me, if a woman has a positive history of cancer, will she should I advise to her to do a genetic testing? I would say I would first ask her, what is she prepared to do if the test turns out to be positive?
Right.
Because if a test turns out to be positive, that woman's life is a nightmare.
True.
She is going to wake up every day thinking that maybe I have a cancer, maybe I have a cancer. You destroy your life just brooding on the fact.
Right.
So if a woman should be she should be aware what she will do if it turns out to be positive.
Right.
So if she is confident enough that she can handle that, only then we would go ahead and do a test. So this is not something which should be used as a routine test to look for the cancer.
So what you're saying is that even if you have a worry that because my mother or my grandmother or somebody close to me in my family had a breast cancer and I am at a risk, but if I go ahead and do this genetic testing and if it comes positive, then what am I going to do?
Right.
Am I going to go ahead and remove my breast prophylactic the way Angelina has?
Yes.
So that you would ask them to clarify in their own
Absolutely.
mind before you go ahead.
Right. The other option I would tell her is undergo a regular evaluation. It is not necessary if I have a family history that I will develop a breast cancer.
Right.
On the other hand, I may not have any family history but still develop a breast cancer.
Right.
So there is no one answer to this. The only way to look forward is be vigilant. Examine, do a self-examination of the breast, learn how to do it. You can visit a doctor who will educate you about it. You have internet websites which educate you about how you should do a self-examination of your breast. Do it regularly. Now, it's not necessary that this should be done only after a certain age. As we have seen, breast cancer is not limited to any particular age. Even we have seen cancers in women as young as 20 years old. Now, 20 years is a very young lady. Now, if she could develop a breast cancer, I don't think we can still say that, okay, if I am 20 or 25, I cannot have breast cancer. No, it's not like that. So, awareness is important. And every woman who has a breast must learn how to do a regular examination of the breast. Visit your doctor. Generally, surgeons are the people who look after breast ailments. Visit a surgeon and get your breast examined at regular intervals. I say regular intervals because there is no time set for younger women. Of course, there are protocols for women who are after the age of 40, where the risk factor for breast cancer is high. So they need to undergo regular evaluations by surgeon, say at least 6 months. This is recommended, not a hard and fast rule. But a regular ultrasound and mammograms of the breast are recommended in women after the age of 40.
So every 6 months undergo these tests?
A self-examination. Self-examination is on a monthly basis. Visit a doctor whenever you see feasible or till you are sure of what to look for and you know what is to be done. And undergo regular ultrasounds and mammograms. How often you should do, you should discuss with your doctor based on your risk profile and your other things. The doctor will explain to you how often is it mandatory that you must do. But it is definitely required for a woman between the ages of 40 and 55.
We've been talking so much about breast cancer. Is that the only thing a woman needs to worry about, or there are other things also?
Oh, there are so many things. Cancer is in the limelight because of, thanks to our media who are talking so much about cancers. But it's a good thing, as I say, because we are increasingly seeing women in the early stages. And we are able to offer cure with simple remedies without having their breast removed, with very little chemotherapy and hormonal therapy, which is so good. I mean, it's so nice to think of that you have a cancer and it has been cured and it's out of your system. But this is possible only and only if it is picked up at a very early stage. So yes, keep in mind, undergo your regular examinations. visit your doctors and learn and educate yourself. Educate yourself and also educate the women all around you. We women, I was joking when I was talking at another gathering that women are famous to talk a lot, right? We talk a lot. We keep chatting.
No comment.
But let's use this skill to educate people and to empower women. It's for the betterment of a society, right?
Okay, so your take-home message is?
My take-home message is do a self-examination of the breast. Be aware of the changes in the breast that are occurring. And when in doubt, if you notice anything, go to your doctor and get yourself evaluated and be sure of what you're getting into. There's nothing, there is nothing more important than looking after yourself. Be aware of the small changes that are occurring and get early attention.
Thank you so much, Pani. I think I definitely learned quite a bit, and I'm sure a lot of viewers are watching, and there are a lot of things. I know that we haven't covered a lot of things, but we can do this again. I mean, it's घर की मुर्गी है कभी भी अंडा दे देगी. So I can always get, I would like to get inputs from you. I would like to understand what all you gain, whether we were audible, whether visible, whether we were sensible, whether we made any sense, whether you learned something. If you had any questions, please raise them in the comment section. Please share this video, please comment, and please like this video, and we will again do it again and come back and talk to you people again.
I'll be very happy to answer all your queries. I'm sure there are many other things that I may need to have talked about, but as I said, breast is it's a huge topic. So yes, we can have another session later.
Thank you so much, and
Bye.
Goodbye, and see you again. Bye.